Fibroids are typically diagnosed when a patient presents to the office with symptoms that the provider would find indicative of fibroids. And at that time, if a patient's having a bleeding concern or pressure or infertility or things that it seems they may have fibroids, the doctor will probably order a pelvic ultrasound and will also perform a physical exam where they'll be able to palpate the uterus. And it's possible that one would be able to feel fibroids in the uterus with a pelvic exam, and certainly with an ultrasound you'd be able to pick up distortions of the uterus, of the uterine muscle that, although it appears more as a grayscale appearance, you can tell that there's something in the uterus that's not normal muscle tissue. Depending on the approach for treatment that's determined, we would then possibly order more imaging in the form of an MRI, which would just give a more clear picture of the exact location and size of the fibroids. We also may order a different type of ultrasound where we would fill the cavity with saline while ultrasound scanning to be able to determine if the fibroid is affecting the cavity. Or we may order a dye test called a hysterosalpingogram, where we would put some dye in the uterine cavity and take some X-ray type pictures to kind of visualize the cavity as well.